There are many different modalities that you can use in order to help yourself feel better, either supporting you during like a flare up or everyday use. Physical therapies. There are physical therapists that you can go and see to help you feel better, somewhere like Athletico or ATI, depending on where you are. You can go to a massage therapist to help reduce that muscle tension, a yoga therapist, a corrective exercise specialist, or even a chiropractor. I do yoga therapy, corrective exercise, and other things like that. However, you will have to go and find a reputable, licensed chiropractor, massage therapist, physical therapist to help you on that journey. There are also complementary therapies like acupuncture. You can do herbal medicine and aromatherapy. For me, for example, I did like acupuncture. I loved the way it made me feel after, but I did struggle with certain points that they'd put the needles in and I would spasm. And this isn't the case for everyone with fibromyalgia, so that's why I always push that it really depends on you and your body, and you have to figure out what feels best. Because I would love to keep doing it if I didn't have such anxiety towards doing it because of the spasming and just how the needles made me feel. And, it just, for me, I really like dreaded going. It wasn't something that made me feel good to go. It made me feel good after, but I just had to weigh the pros versus the cons there. So I do highly recommend trying it and seeing how you feel, because maybe it's something that works amazing for you. Where I adopted herbal medicine and aromatherapy as well. So those are things that worked better for me that I added into my repertoire. So, for alternative treatments, there are many different ones you can do, like hypnotherapy, which hypnotherapy is awesome. I love hypnotherapy. I even use some of those techniques in our guided meditations because they really help you get into a relaxed state of mind and access your subconscious, which helps with our reactions, our immediate thoughts and things that when we're not totally conscious about. It also there are many different things that you can do with like hydrotherapy, so water therapy. A lot of people with fibro prefer the warm water because it helps them relax and release tension. It's easier to move the body versus cold water. Cold can be a contraindication of fibromyalgia. Some people with fibromyalgia really struggle with it being super cold in the water, or whether you're doing like cryotherapy. Generally, you're not supposed to do cryotherapy with fibromyalgia. That's because of certain symptoms. For example, I have Raynaud's, which is when the blood flow doesn't go all the way to your hands, and your hands can turn white and they are really cold. So that is you're not supposed to do any kind of cryotherapy when you have Raynaud's, and even fibromyalgia can cause issues as well. So, and Raynaud's is a common symptom of people with fibro. So it really just depends on you. But I've done the warm water therapy, and that feels so nice because you can just move in there, and a lot of places, even hospitals, will have like warm water pools. So I would try that. There is something called biofeedback, and it involves learning to control physiological functions such as heart rate and muscle tension and reduce pain and stress, which, as you know, a lot of people with fibromyalgia have issues with their heart rate, like high heart rates, tachycardia, things like that. And it helps individuals with fibromyalgia by providing real time information about their physiological response, such as their muscle tension and heart rate. And this awareness enables individuals to learn and apply techniques for stress reduction, pain management, and muscle relaxation. So I definitely recommend biofeedback as well. I know there's a lot that you can do. So maybe you just, try a couple and see how you feel. Try a few that resonate with you or that you have available in your area. There's also magnetic therapy, which I have heard that this has helped some people with fibromyalgia. I don't really know much about it, but I figured I should mention it. It does say that some individuals explore magnetic therapy using magnets in various forms, believing they may alleviate pain and enhance circulation. Okay. There are also some really helpful products. I love using a TENS unit. So that's what you see in the picture here. It's a electrical stimulation, which you can buy them at Walgreens nowadays. And sometimes your insurance will even provide them, or physical therapists and chiropractors have these as well. And they really help. It almost provides an alternate sensation than the pain, as well as manipulating the muscles to get everything to relax and release tension. Heating pad, always good. Release tension, provide pain relief on the spot. Some people like a cooling sensation. Ice tends to make things more tight. So I always go for like a biofreeze or a pain relief lotion that maybe has a cooling factor. Pain relief lotions, though, awesome. I definitely recommend those. If you do have a medical marijuana card, or maybe you have a recreational marijuana legally in your state or country, then you can always use those pain relief lotions that they have, because those work really well. When you have the CBD in there as well, it really helps to alleviate pain. So let's see. Many of these items can be found on the fibrosolution.com. I have a little store on there, so definitely check that out. For emotional and psychological support, you can always go to a therapist, receive some cognitive behavioral therapy, which helps you reframe negative thought patterns and develop coping strategies. We work on a lot of this stuff as well, but sometimes people find it easier to do this with someone else, one on one. There are also support groups. So you can join a fibromyalgia support group and provide a sense of community and understanding and fostering emotional support. We know that sometimes people aren't so supportive of those with fibromyalgia because it's an invisible disease. I mean, like, look at me. People would never think that I have something as severe. I have severe fibromyalgia and it affects me every single day. So, last couple things is psychotherapy, which can offer a space that is safe and explore and address emotional impact living with fibromyalgia. And we look at our sleep hygiene and our sleep routine, because when we establish a consistent sleep routine, optimizing our sleep environment, and it betters our sleep quality. And this is huge. So you can create a comfortable, dark space so you can sleep better. And lastly, we look at our relaxation techniques. And these practices, like progressive muscle relaxation or guided imagery before bedtime, these enhance relaxation and improve sleep. So you can even go on YouTube, put on a sleep meditation, or in the program, we provide a yoga nidra meditation that literally brings you into a deep sleep state. There's so much information in the book as well, but here are some modalities that can help you.